Okay, we look like we're good to go. Good afternoon, everybody. Welcome. Hope everybody is well and able to get outside if where you are is sunny. Still is right here. My name is Abby Stamp. I'm the Measure 110 or Burn Program Executive Director, and my pronouns are she, her. And I'll be assisting, I think it's Keisha today, with facilitating today's meeting. The Oversight and Accountability Council welcomes and encourages community input. Members of the public are invited to submit public comments or get on our interested parties' emails list by emailing oha.measure110@oha.oregon.gov. That email address and more information about the council can be found on the Measure 110 OAC website. OAC members have asked that OHA and other staff who are present in the meeting space introduce themselves in the chat. Please share your role with the agency. And if you are a subject matter expert, your area of expertise, I'll now turn it over to Keisha for opening remarks.
Welcome, everyone. Good afternoon. Short but sweet. I'm gonna turn this for the agenda today. We have the Clatsop County Public Health presentation and vote. And I'm gonna turn it over to Carly for attendance so we can jump right in.
Thank you, Keisha. Ami.
Here.
Amy. Caroline. Dharma. Hubert.
Here.
Hunter is excused. Jackie.
Here.
Keisha.
I think I'm here. No, I'm here.
Leticia.
I'm here.
Mason. Melissa.
Here.
Morgan. Ryan let us know he's going to be a little late. Sabrina.
I'm here.
Zeb.
I'm here.
Sam.
I'm here.
Annalise.
Here.
And we have quorum at exactly 10. Back to you, Keisha. Sorry.
Did you have something, Abby?
Oh, sorry, Keisha. I was just going to let folks know that please let us know if you need anything comes up and you need to go offline so we can monitor quorum because we're right there at 10. Thanks, Keisha.
Thank you. So is our Tillamook County Public Health ready to present? All right. Here's our presentation.
Hi, I'm Lisa Schuyler. I'm with Clatsop County Public Health. She, her pronouns. I'm the health promotion supervisor. We also have Jill Quackenbush, who's our deputy director and public health administrator, who's on the meeting today, as well as Scott Huddleston, our fiscal coordinator, who are joining me. Thanks for allowing us to present today with our proposal for our budget adjustment. The reason that we're asking for this budget adjustment is because, as it says on the slide, our harm reduction program has had higher FTE staffing needs and lower supply and training costs than expected. And to continue operating the program in its current capacity, we would need to shift our burn budget and funding to better support staff who are working directly with our clients. So in this picture here, we have Nadine, who is our harm reduction coordinator, and we have Darby, who's the program assistant. And really, our employees are the backbone of the program. They're the ones who are building relationship with clients, and their knowledge and experience and training is what's making the program work. You can go to the next slide. So our harm reduction program is operated by Clatsop County Public Health. And the services that we offer are for across Clatsop County. We're a rural county in the northwest corner of Oregon. So to the west, we have the Pacific Ocean, and to the north, we have the Columbia River. This quote here is from our original request for burn funding in our grant proposal, and it still is what we do operating the program. So Clatsop County Department of Public Health will continue to hold weekly syringe exchange events in which additional harm reduction interventions and activities take place, including naloxone distribution and training, distribution of safe drug use and wound care supplies and information, fentanyl test strips, and wound care supplies and information. Oh, and connect participants to community resources, including treatment and recovery. So we're also the only syringe exchange that is operating in Clatsop County. At the moment, there are some other burn-funded members that are operating harm reduction elements, but we're the only ones that are doing the syringe exchange. So you can go to the next slide. So between last year and this year so far, we've operated approximately 60 weekly events. We really only cancel events if inclement weather is so bad that it wouldn't be safe for staff to go out, or if there's a government holiday and so staff can't work. And so our program is really dependent on our staff and their expertise, and also on the partnerships that we have. Clatsop Behavioral Healthcare offers peer services. They come to our weekly events with us. They're the local mental health provider, and they're also a burn member. And then we've seen in the statistics lately that there are less people who are using syringe injection drugs as their mode of use, which is another reason why in our weekly events, we have potentially not been needing to use as many supplies, but we have been expanding partnerships with other peer organizations and doing more outreach to get the word out about harm reduction, and also to share naloxone and the other elements of the harm reduction program that are still important. We did 13 events between 24 and 25, and that was 760 plus attendees that we reached at those events. We included information about our harm reduction program. In every box of naloxone that we give out, we stick our harm reduction business card in there with it. And then we also do naloxone training and distribution at those events, or we also offer naloxone training and distribution to businesses and organizations across the county that upon request. So some of our outreach events are just purely for sharing information about harm reduction and naloxone. And then we also host the Overdose Awareness Day event every year, which is an event to kind of bring awareness to reduce the stigma of drug use, and kind of humanize the people behind the statistics of overdose, and to grieve the loss of them in our community. And we also operate this program in coordination with the overdose prevention program that we receive funding for and operate within public health as well. You can go to the next. Oh, I forgot to mention the sectors. So of that outreach, there's schools and family, veterans, seniors, the unhoused, LGBTQIA, businesses, local businesses, and law enforcement are all engaged in that outreach. And I forgot to mention, we also moved our data collection from being a paper form to being a data collection electronic tool that we worked with our IT department to create, or our harm reduction staff worked with our IT department to create, which makes data collection a lot smoother and more efficient. And also, sorry, and also allows us to analyze the data a lot easier. So that was a big win for us over the last year. Okay, now you can go to the next slide. Thanks. So this is a breakdown of the requests that we're making today. So as you can see, our staffing is higher than we expected, and then our training, our service and supplies, and our administrative costs are much lower. And I think the personnel, another important thing that maybe is the reason why it was under. As you can see, there's an increase in FTE that we're requesting. And that's because we want to consistently operate this program. And so if there's a staff member who's out sick unexpectedly or has another meeting or responsibility that they need to do, then that we still want to go out and do our weekly harm reduction, because that's what's best practice, is to consistently be offering this service on a weekly basis. And so if we have a staff member that's going to be out and we need 2 staff members to safely operate the program, then we need alternate staff members. And so I think that the staffing levels were maybe a little bit higher than we anticipated, because we weren't anticipating, we didn't figure that into our costs. And we also are lucky that we have, in the last few years, we've had other sources of grant money that we were able to use for supplies. We're part of the Save Lives Oregon Clearinghouse, and so we were able to utilize them. And we also have received funding for supplies from Columbia Pacific CCO, but that funding is something that's renewed on an annual basis, and so it's not guaranteed. It's not guaranteed for the future either, but it wasn't guaranteed when we first made our grant request, and we're really lucky that we've had that to kind of balance out our funding and be able to buy those supplies. So it's mostly the staffing where we really are dependent on burn funding for that, and we are really appreciative to have it. Okay, you can go to the next slide. So thank you so much for having us here to bring this proposal to you, and let me know if you have any questions.
No, I'm not seeing, Zeb.
Yes.
Right.
Thank you, Keisha. I just want to say thank you for the presentation, and thank you and your organization for all the hard work that you do.
Thank you. We really appreciate it.
And I'm not seeing any more hands, so thank you. I think you'll hear from us in a minute.
Hey, Abby, I completely forgot to put a conflict slide in there. So if we can call for conflicts before we vote, that would be fantastic.
Keisha, would you like me to do a conflict check right now?
Sure. And
Yeah,
then,
great.
and then go into discussion and then vote.
Great.
I mean,
Perfect. So that was the topic for discussion today is a budget adjustment for Clatsop County. And are there any actual or potential conflicts of interest with that provider or any other conflicts with Clatsop County Burn? Actual or potential conflicts of interest before we start. Dharma,
Can you remind me of what the other agencies are in Clatsop County?
can you say a little louder, please?
Oh yeah, sorry. Could you remind me of what the other agencies are in Clatsop County?
Yeah, I'll pull it up. 1 minute, please. Okay, in addition to Clatsop County, who is presenting today, we've got Clatsop Behavioral Health. Apologies, 1 second. Here we go. Clatsop Behavioral Healthcare, Clatsop Community Action, Helping Hands Reentry and Outreach, Iron Tribe Network, and Providence Seaside Hospital Foundation. Liz or Jason, are there any other Clatsop providers that are current partners that are not going to move forward to the next grant cycle? Or is that everybody?
I think you got everybody, but since this is a budget adjustment specific to this organization, I don't think we have to worry about conflicts with the other burn partners. I think it's just this agency. If somebody wants to confirm that.
Well, I think because we go county by county, it's every agency in that county.
Well, I am not hearing any conflicts, actual or potential or otherwise. So, Kish, back to you.
All right. Do we have any discussion? Yes, I'll make the motion. I move to approve the Clatsop County's budget adjustment request as shown in the presentation.
I second it.
Keisha moves, Hubert seconds. Any other discussion? Okay, Carly, do a vote, please.
Me, how do you vote?
Yes.
Dharma,
Yes.
Hubert,
Yes.
Jackie,
Yes.
Keisha,
Yes.
Leticia,
Yes.
Melissa,
Yes.
Morgan,
Yes.
Ryan,
Yes.
Sabrina,
Yes.
and Zeb.
Yes.
And that passes with 11. Back to you, Keisha.
I think that might be. Sorry. The end of that agenda. Let me check. Unless we have some OHA updates. To the agenda. Is that all we have on the agenda today?
Yeah.
Yep, that's it. I don't know if you have any OHA updates. If not, then guess we're gonna be giving some time back today. So I hear nothing. OHA update. So thank you guys for showing up and getting this handled. And please have the rest of the day be productive.
Thank you. Bye.
Thank you, everyone.
Thank you.